Hi everyone, my name is Savannah, and I'm going to be describing the relative influences of exercise and injury on the childhood growth process. So for exercise and injury, there's two things that can go with that. That's like physical activity and then also like physical inactivity. A lot of times, young kids are not as active, and then if they do become active, then they can that can lead to injury. um, so appropriate levels of physical activity will result in increased muscle mass, which is muscle hypertrophy. And that is just the developing of muscles and they're getting stronger and bigger. Increased lean body mass, so they're having like less body fat, and a leaner, just a leaner look to them. And then increased bone mineralization, so like their bones are stronger, and that goes along with like calcium too. um, too much exercise can result in epiphyseal injuries, so like injuries to like the bones. Growth plate damage, so when a child is developing, their growth plates are still obviously open, because their bones are still growing and developing. So we see the growth plate damage if an injury occurs while a child is still developing. And muscle and tissue injuries occur as well when participating in physical activity. That just comes with it, but it can be avoided if it's not overused. So if a child is like regulated in the amount of like exercise they're doing, or like the amount of time that they're in a certain exercise, then they're less likely to have like these overuse injuries. Too little exercise results in like decrease in muscle mass. You see like kind of overweight, and that's muscle atrophy. So that's a decrease in muscle mass. So then the increase in fat mass, you aren't going to see as like lean or like toned. You're going to see more like fat mass. Increases in risk factors associated with obesity and overweight. So when a child isn't physically active, we see them playing video games or staying sedentary inside watching TV. These factors can become an issue. So